welcome to part 3 of the innate immune system. Remember, so far when we look at the innate immune system, everything that we're looking at on this side of things, whether it's phagocytes or the physical barriers, remember it's non-specific. So it doesn't matter what type of pathogen, it's going to act the same way. Even those natural killer cells, they're not specifically going out targeting the chickenpox virus. They're just looking for any antigen that doesn't match the list that they have of what belongs to self. So this is innate immunity. It is non-specific, and we have no memory. So how it attacks is the same every single time. We don't have a greater response to the chickenpox virus by our skin just because we had the chickenpox virus once. It will respond the same way by trying to keep it from even getting into our body. All right, so we are looking at the inflammatory response. So we have a couple of outcomes that go along with this. Don't get overwhelmed. They're actually fairly simple, but I just broke them down so we didn't have one big long outcome. The first outcome is to describe the mechanisms of inflammation initiation. In other words, what starts this thing. Then we're going to summarize the cells and the chemicals that are involved. There are 3 cells that we're going to look at. Specifically, we're going to look at mast cells. And then we're going to explain the cause of the 4 cardinal signs of inflammation. So if you are in healthcare at all, or even if you just simply have had multiple injuries, you'll know these 4 cardinal signs. Redness, swelling, heat, and pain. Whenever you've got an inflammation happening, you'll see that. And then we'll explain why inflammation can be beneficial, because sometimes it just feels like when you twist your ankle, it's a pain in the neck to have all that inflammation going on. So we'll look at why that's a benefit for you to have that happening. Okay, so the first thing we want to start out with is, how does it start? In other words, what's going on? Why do we have this? So what happens is cells get destroyed and there's tissue damage. So if you look at this illustration right up in here, you can see that we have a splinter that came in, and when it did this, it damaged cells along the way. When it did this, this damage, so it could come from this actual impact where we actually have something poking in. It could be an abrasion. So if you're like me, I tend to be prone to skinning my knuckles every time I walk beside a brick wall because I don't know, I can't walk straight, I guess. And I'll run my knuckles up against the edge of that brick wall and I have an abrasion. I'll tend to have some inflammation that goes along with that. If you have a chemical irritation, that can sometimes cause inflammation. So, sometimes for certain people, if they use a particular type of lotion, it will cause inflammation to happen. If you have an infection, you can end up with inflammation. So we talked about the fact that your lymph nodes, when they're recognizing a pathogen, can become inflamed. You'll feel them become swollen. Or even extreme temperatures. So if you're exposed to something that's really, really hot or really, really cold, you've done enough damage to those cells that it will cause inflammation to happen there. Any of these events that can happen, basically what it does is it alters the interstitial chemical composition. So what we typically would have in that interstitial fluid is now different. And when that chemical change happens, that activates mast cells. Okay, so that chemical composition change is what activates these mast cells, this damage. And when mast cells are activated, they're going to release 3 things. They're going to release histamine, prostaglandins, and heparin. Now, the histamine makes the capillary beds more permeable, and so it actually causes them to become kind of leaky, and that will speed up blood flow to the site of this damage. And I want that to happen because I want to bring in my immune system to this area. I want to get white blood cells in there. I want to get macrophages in there because I want them to start getting rid of debris. I want to get microphages in there because if there's any bacteria in the area, I want them to start taking care of it. I want to get all of that happening, and so I bring that in. Prostaglandins are going to help with vasodilation, and we know that if we dilate the blood vessels locally, it's going to cause more blood flow, again, to get that immune response to the site where the injury has happened. And mast cells also release heparin, which seems kind of counterintuitive. We know that heparin is going to prevent blood from clotting. But if you think about it, it'll make sense. I don't want a clot to form right at the site of the injury. So if this is where my injury is, I need to be able to get white blood cells in and out. I need to be able to get those lymphocytes in and out. I need to be able to handle this debris and start making repair. So I want heparin to be in this basic area so that I can prevent a blood clot from forming right at the site of injury. Now around the injury, like out in on the borders, I want a blood clot to start to form there. Okay, so you can see up in this one, I have some blood clot forming in here, but I don't have, the blood clot doesn't expand out to this damaged area because I want that damaged area to have an opportunity to actually be taken care of. Okay. Neutrophils, when we have this damage, it's going to be releasing these cells, these tissues that got damaged are going to release chemicals, and so that's going to draw neutrophils to the site by chemotaxis, and they're going to secrete, the neutrophils themselves are going to secrete cytokines. That's going to attract more neutrophils to that area. It's going to attract more of the macrophages to that area. It's going to start bringing more and more things in there. And the macrophages are going to come in, they're going to help with cleanup, so all of this tissue debris that you have, so these cells that were damaged, it'll start cleaning up that. If there is any type of pathogen invasion, so you've got bacteria on that, the macrophages are going to take care of that as well as with the neutrophils, so they'll help work with that one. One of the effects that you can end up with this inflammation is you're definitely going to have necrosis. It may not be much, but necrosis just simply means tissue destruction. So we often think of necrotic tissue because we don't talk about it until there's huge areas of necrotic tissue. But even if you just simply have a bruise on your arm because you ran into the door or whatever, I tend to do that. Maybe you don't, but I tend to be clumsy and run things in. A bruise is typically has a little inflammation that goes along with that, and the reason why you've got that inflammation is because you've done some damage to the tissue, so you have a little bit of necrosis there. If you ever have an injury that has pus, pus actually shows you that you've got a mixture of debris and fluid and dead and dying cells, along with some white blood cells in there as well. So it tells you that, hey, things were definitely damaged. A lot of times what you want to do is you'll clean out that site of infection, kind of get rid of that pus. If it's on the outside of your body, just to help your body get rid of the debris so that it can start the healing process. An abscess is when there's pus that's formed in an enclosed space and it doesn't have any way to really release itself. So we'll sometimes hear about somebody who has an abscessed tooth, and what often happens is the root canal within the tooth is damaged or dies, and so we have this necrotic tissue, we have this pus because of all of the inflammation that happens, and you don't have anywhere for that to go because, as you know, your tooth is made up of that hard dentin with the enamel around it, and so this abscess actually pushes on the nerve in your tooth, and that's what causes you to have pain. If you open up the PowerPoint, you'll see that there's a tutorial down here. If you want to see more help, get more help on this inflammation process, feel free to click on that one and take a look at it. These signs of inflammation. So if we start thinking about what all is happening at the site of inflammation, it makes sense that you have what you have. Redness. You have redness at a point of inflammation because of the extra blood flow that's coming there. So those dilation of the blood vessels, those blood vessels are leaky, we've just had more blood flowing to this area, that's going to cause it to become red. It swells, again, because of the leakiness of these vessels. The vessels are leakier, more fluid is going out into that interstitial fluid, and you're going to see that by seeing it swelling. Heat, again, this comes from the blood flow. So more blood flow to that area, it's bringing warmer blood constantly there. This actually has some benefits. By increasing the temperature at the site of the infection, it will cause an increase in enzymatic reactions, which means hopefully the healing process will happen faster. And last but not least is pain. With this tissue damage and this chemical change in the interstitial fluid, that's going to stimulate your local pain receptors, and they're going to send a message. And that's actually a good thing because it tells you, hey, there's something wrong here, you need to do something about it. So what are the benefits of having an inflammation? Why is this actually helpful, and how is this part of our defense mechanisms? Well, the first thing is it helps to prevent the spread of bacterial infection by swelling this area, bringing the blood supply here. We form a clot, we kind of prevent this, and we kind of block this area off and prevent this from prevent whatever type of pathogen that may have come in from moving away from this site of damage. It also eliminates debris. We have to get rid of the tissue damage that's happened, and without attracting neutrophils and macrophages to the site of damage, we wouldn't be able to eliminate the debris, and that over time would be a problem. We just keep collecting these dead cells everywhere, and I can't quite imagine what we would look like if that debris wouldn't be removed. It also initiates the healing process. By removing the debris, it gives room for the fibroblasts, those are the ones that produce collagen fibers, to start doing their job and start laying down scar tissue. It also will activate the specific defenses. A macrophage engulfs a pathogen. It puts out a class 2 MHC saying, hey, it becomes an antigen presenting cell, tells the immune system that, hey, we've got a problem here, and starts creating a specific defense against that antigen that came in. So those are the benefits of this whole process. We also have, when we move on, we have antimicrobial agents. These are going to be chemicals, and the first one we're going to look at is interferons. We're going to explain how both complement and interferon function as antimicrobial agents. When we look at interferon is released by activated lymphocytes, macrophages, and viral infected cells. And what these interferons do is they bind to the surface of a normal cell. And we're going to specifically look at interferon alpha for right now. Okay, it binds to the surface of a normal cell, and it triggers the release. It causes this cell to release antiviral proteins. And these antiviral proteins help protect healthy cells. They don't do anything for the already viral-filled cell that's going to fill up with the virus and die. But what it does do is it protects the healthy cells that are around it by producing these antiviral proteins. These antiviral proteins don't allow the virus to replicate. So it's not that the virus can't attach to a new healthy cell and go into the new healthy cell, but once it gets in there, it can't do anything, and that protects the healthy cell from being damaged further. We're not going to spend any time on interferon beta or gamma. You can look at these illustrations and see kind of what they do, but I'm not going to test you on it. I just wanted to put it out there that, hey, we have one type of interferon that protects us against viruses, and the other ones deal with inflammation and natural killer cells and macrophage activity. Right? All right, that's the end of this part of the lecture, and we'll finish up with complement and fever in the last part. It'll be a short little lecture for you to listen to. Okay, see you in a bit.